Prostate is a gland. A gland means it is a small structure which is located just below the urinary bladder in males only. Prostate is seen only in males and not in females. So this thing, when a male child is born, it is very, very small. And as the age progresses, with the age, the prostate also becomes enlarged. So after the age of 50 years, generally the prostate creates its problems because of the enlargement of it. After the age of 70 years, almost 70 to 80% of males have prostate problems. So in order to understand about its problems, the thing is the age. With increasing age, the prostate size increases. The normal prostate size is 15 to 25 grams. However, the size only does not correlate it with the symptoms. After the age of 50 years, as I said, the prostate problems can start. And after the age of 70 years, almost 70 to 80% of males will have prostate related issues. Prostate problems typically arise in males after the age of 50 years. However, it is not always, it is the norm, but there are exceptions. Even young people can have prostate related problems. Now, as I said, the prostate is located at the neck of the urethra and the urinary bladder. So, obviously, the problems will be related to urine. So, let me show you a visual thing. Now, consider this to be the urethra, and this is the urinary bladder. Now, as you can see, the urethra is quite wide, and this is the bladder. Due to the prostate is located here, and because of its enlargement, the urethra, it narrows down. So obviously, urine flow decreases. The urinary bladder has to apply more pressure to pass urine. So in the bathroom, patients typically take a long period of time just to void. The flow is not good. There is sensation of incomplete voiding. Patient feels that a little amount of urine is left in the bladder. In order to clear that urine, they have to go again and again. This typically increases during the night time. There are chances of repeated urinary tract infections in these patients. There are chances that there might be complete urinary retention, as in patient won't pass urine at all. Let us have this representation again. This is the male urethra, and this is the urinary bladder. If the urethra is open like this, the urinary bladder will contract smoothly and the urine will flow through this. Now, if the urethra, because of the prostate, becomes narrow, so the urinary bladder has to apply a large amount of pressure for the urine to pass. Now, if it does like this for many years, what happens is the urinary bladder walls, they weaken. So now what will happen is, instead of contracting fully, they will now start to contract a little bit less. As age progresses and these symptoms they worsen, that a time might come when the urinary bladder won't contract at all. So at this period of time, the patient will not be able to void only. So even at this time, now if the patient comes and tells us that we want to remove this prostate, so even if we make this wide, but because the urinary bladder is not coming like this, the patient won't pass urine. So in order to save your urinary bladder, you need to take care of prostate problems. Patients having symptoms, having problems, along with a bad report, warrants treatment. Just because in a general ultrasound checkup, the prostate size has increased does not mean that you warrant a treatment. First, I hope this is clear. Now, the second thing is, if the patient is having prostate problems and if even the reports that needs to be done are ultrasound of the prostate with pre-void and post-void, means pre-void means before passing urine, what is the amount of urine which is left in the bladder? Post-void means after passing the urine, what is the amount of urine which is left in the bladder? In prostate related issues, the post-void will be high. That means that the patient is not able to void fully and some amount of urine stays in the bladder even after the patient has gone to the washroom. So this is one report. The second report which is done is a serum PSA. PSA means prostate specific antigen. The prostate which is now getting enlarged might have two causes. One is benign and one is that might be cancer also. So we need to get a PSA report done also. The third report which is important is a uroflowmetry. Uroflowmetry means it is basically the patient has to void in a machine and the machine will show a graph stating how the patient's flow is. And the fourth and rest of the reports are normal, like urine routine micro, urine culture, all these reports are normal. But these three reports are main and they should be done. Any patients who come to us with prostate and its symptoms warrants treatment. Treatments can be divided into two parts, medical treatment and a surgical treatment. According to guidelines, we generally start with a medical treatment first, in which a drug is given to the patient. He has to take this drug at night time. Normally, there's a single drug. So, what this drug does is it causes prostate compression and hence the urethra opens, and so the patient will be able to void better. Certain patients are good with the drugs and they can take the drug lifelong. Certain patients, the drug might affect for a period of time, and once the prostate becomes so big that even the drugs don't affect, then we get to the surgery part. So then the surgical treatment comes. Surgical treatment as of now for prostate has become very safe. In the past, we used to open the abdomen and take out the prostate. But as of now, it is all endoscopically. There is no scar, no wound, and almost painless. We go through the penis of the patient, through the urethra, and we take out prostatic chips so that the area of the prostate widens, the urethra over there widens, and the patient is able to void. As I just mentioned, prostate surgery as of now is very safe. We generally, after prostate surgery, we keep the patients for 1 to 2 days and then we discharge the patient. Once the patient is discharged and the urine pipe is out, for 1 month we ask the patient to not to do heavy straining, as in not to lift heavy weights, not to go to the gym, not to do heavy physical exercises. Normal amount of work can be done, that is not an issue. Normal day-to-day activities can be done. After 1 to 2 months, when the prostate fossa is healed, the patient is allowed to do everything. So there are no precautions. The only precautions is whatever the doctor says, what the time period to follow, which is generally after a month and then after 3 months, to be followed up regularly by the patient.